play. What is the difference between the sliver on your left and sliver on your right? Are they the same or is there any difference? Anyone wants to guess? So, sliver on the left has single row follicular units. The purpose of this is that you can clearly see between these follicular units and facilitates dissection. Units, which makes dissection more difficult because when I'm cutting following this follicular unit, I may accidentally transect this unit behind because I can't see clearly. The transection here is done during the strip extraction. So if I look at the strip, when I see the side of the strip being transected, that tells me is the physician during the harvesting transected hairs. So when I make sliver out of this piece, this is what it looks like when I see transection on this side of the sliver. So if you see the difference, the transection on this side of the sliver means the assistant made it while slivering our tissue. So understanding what you see and what that means, it's important. And I mentioned this earlier, I don't know if I counted this, but if I look 1, 2, 3, 4, 5, 6, 7, out of 7 follicular units, 3 are wasted, and all during the donor harvesting. So even when you're doing donor harvesting, you have to be careful. You can have the best assistants in the world, but if you destroy the tissue, it's destroyed. Because these...
Can you explain how the blade was improperly angled to cause that pattern of transection?
So I'm going to show, I have a next slide that should show better. So let's try this. So this is a neutral position of the blade, which should be parallel to the hair follicle. You follow me so far? So this sliver has 2 types of transection. By blade angling toward the tissue and cutting that way. Can you see, this is the edge you see more, and a sharp edge was facing toward the sliver. Can you see that? And then this portion happened by tilting blade, so it was, oh, I made a transection, I overcorrected, now I made a transection here. Can you see that? Okay, good. So neutral position, see the difference? Neutral position, see the difference. When I say neutral position, which means my blade was parallel to the hair shaft, in this case it wasn't, it transected here. In this case it was overcorrected or tilted the opposite. You see that, right? Another thing, we were talking about graft drying and dying. So recognize that the moment it starts looking dull, that means it's drying. Pay attention to the subtleties. Looking dry is dying. And then the more during the implantation, if the assistant or whoever is placing grafts is sorting them through constantly, trying to repositioning, regrasp them, they are drying and dying. So in this case, what I'm trying to show is that, for example, these 2 grafts are, before being trimmed, this is what they look like once they are trimmed. Before being trimmed, it's a 2-hair graft, and this is a 2-hair graft. Without trimming, they would fit in 2 different size sites in order to fit properly. So the idea of dissection is that person who is dissecting, usually the 2 hair follicular units graft should occupy the same space. So the consistency in dissection and trimming is important. Anyone wants to tell me, is there any difference between these 2 grafts? Yes, no? How many would say yes? Okay, yes. So the difference is, this one is transected, this is a telogen hair. So how I know the difference is, I see that there's a little bulb on the bottom. It tells me that this one was transected and this still has. So would this one survive? No, because it's half, less than half, especially top half, right? So it would not survive. If you try to trim it, you risk to damage the other one. But if you want to place it as a 1-hair graft, you make sure you don't place it at the very front row of the hairline. So what I want to kind of share with you regarding the front row of a hairline, what you consider the front row, it's not a straight line. It's the line that becomes exposed to someone looking at the hairline, which means everything this you staggered becomes the first row of hairline, right? But what if some of those grafts don't survive? You want to back it up at least with one more row of 1 hairs, because if the first one does not survive and you put the 2 hairs behind, then they become exposed. So the first row is never a row, but it's anything that you can see within when you look at the hairline. From these grafts, how many would we have? Do I have any good grafts in the first one? Yes? No? How many would say yes? Do I have at least one? Okay. Actually, I don't. This is a half, bottom half, it would not survive. So if I look the full length of the hair shaft, this has no bulb, and it even have it's transected on both sides. This one is transected, the top is missing. The bottom, if I take and kind of look at the full length, it tells me about the half, it will not survive. That would say for this one, this is even a third, it would not survive. This one, how many do I have good one in? 1, yeah. And so once again, it's same thing. It would, if you start trimming, it becomes more, you expose your graft to chance of being transected. So over trimming is not good. So starting practice, I would say keep the grafts a little bit bigger, the more tissue around the graft, as long as they keep the consistent size. So more tissue doesn't mean more tissue that varies. More tissue means a little bit more tissue around. I taught my assistant downstairs, keep a t-shirt, but not a heavy coat. So maybe something in between, kind of think about what envelops the hair shaft, how thick it is. This one has a good 1 hair shaft, but how about this one? Would this one survive? Yes? Maybe? No. If I place this one in, so what happens with this piece, since it's not firmly attached to the other structures, it could twist and it becomes like a foreign object, so it can cause like a pimple inclusion cyst. So you want to trim that. The way you trim it, you position your blade and kind of cut away from this good follicular unit so you don't damage that one. Any good ones in this one? No, there's no good ones in that one. White hair, we can color the top of the strip so we can kind of envision where the hair goes. It's hard to see it. So it does help. If your patient is coloring hair, normally tell them to, meaning that's they're normally coloring hair and they have their natural hair is white. Ask them to color hair a few days before the surgery, right? You don't want them 24 hours because there may be a color residue. We used to use just for men in color before the surgery, but you have to be very careful. First, you have to make sure that all the color is rinsed off. If you don't have station where you can wash patients' hair and wash all that off, you may carry that color into the dish with grafts and kill the grafts. But the other thing that you have to make sure is that if you decide to color a strip that you're going to excise, if you color a little bit whiter and the person has a white hair and you suture and leaves a black line in the back, they won't like you. So you can't be cavalier about that. And so what helps, if you cannot color hair or the patient cannot color hair, what helps is to use backlighting. When the tissue is illuminated from the top and the bottom, you see the hair follicles better, hair shafts a little bit better because they're a little translucent. And sometimes this is the same sliver. You can't see the dark hair follicles here as much. All of a sudden you see them better there. Does that make sense? So that could be a good help when you're slivering and dissecting, when you're slivering and dissecting the white hair. When making grafts with 1 hair, I find one that has a full length. That becomes my measuring stick. If any grafts are shorter, that tells me this is transected because oftentimes you can't see the bulbs. If I see these pointy little grafts, that tells me that all bulbs are transected. So start with one, a good one, and keep it there to remind you how long it is. This graft what's wrong with this picture? Holding it too high. And the reason being is, if I hold it here and try to insert it, that means that I am leading the insertion with the hair follicle. So that means the bulb has to make the path within the site. If the site is slightly closed and I have to force it in, by forcing it in, I had another picture that apparently didn't show. What it does, it kind of folds in and bends. So the forceps should come like this, not like that. Does that make sense? Okay. Oh, there it is. So this is what it did. Making sites and making sure that the depth of the site and the width of the site match. It is important, and making sure that your assistants are knowing. So remember how I was saying the first row of 1 hairs is all this. It's not just that. If you make sites with the same tool, then your assistant should trim the grafts to the same size. If, for example, if I look at these grafts, the way they fit, they would fit in the same size site. But if I look at their hair content, once they're trimmed, this is a 1 hair graft, the middle one is a 3, and the other one is 2 hair graft. So what I'm trying to show with this is that trimming is important because it has to fit into your size site. If you decide to mix 2 and 3 hairs and place them in the same size incision, then you have to match to the bigger graft, because otherwise you will cause a compression. So you match it to the bigger graft, then these can be mixed. This one has to be trimmed and fit in a smaller site. As long as there's agreement between you and your assistant, it's a creative process. It could be very fun if there's a communication between all of you. If the grafts are too big in place, so this would be, if I place these grafts all in the same site, so for example, I put 1 hair graft and then there's a 2 and this is a 3 here, and I intentionally placed it close to the hairline, then what happens, you get, not only that you have a compression, because if I put the 3 hair graft in a site that is big enough, when the hair grow, they have a space in between them and they look natural. But if I compress them, when they grow, they have no space to grow out, so they come out and look like a clump. So this is what compression looks like. There's a pitting and compression, but I want you to focus. You see how if these grafts were placed see here, they have a space to grow out and expand. So it's probably the same, it's a multifollicular unit that was placed in a site that was proper size and incorrect size. So the same thing, see, this is kind of creating, has enough space, this one didn't have enough space. So not only trimming, but also teaching a proper fit, graft fit. So this is pitting. It's a different problem that we encounter if the grafts are placed too low. When the grafts are placed in the skin, they're a little engorged from being in a storage solution. So we place them in a skin, and then what happens is they start shrinking or losing the volume, and by doing that, they kind of slide underneath. And if they're placed flush with the skin, they're going to sink below the skin and cause pitting. Not only that they're not placed flush, but they are probably lower. So when we leave our hairs on a hair, when we harvest donor, we leave hairs certain length. So for example, all these grafts are the same length and they're placed at the surface correctly. These 2 are lower, so it's not only, so it shows me how much hair is sticking out of the skin is first indication that the graft is placed underneath. So what needs to happen, they all have to be pulled up. During placing, there has to be a communication. So for example, these 2 assistants are moving from outside in, not realizing that this is a critical portion to be placed. You place this first because of the blood supply. The second thing, this is the area that has the core density. So you want to make sure that you have enough graft. If there's any chance of miscalculation and this is missed, And all these, it's going to look like horns and no enough hairs in the middle, right? And then the moment you start repositioning the grafts, you have chances of damaging them. So during the placement, not only that we constantly evaluate what has been done, we're also evaluating what the other person is doing. Are we on the same page? One person is faster than the other. So for example, if we're not paying attention to that, and let's say we are short in grafts, the person who is faster finishes and the other one side is now running short. So constant communication, overseeing the area, but overseeing what we have left. Where are we going? Where we are, where we are going, where have we been? So kind of looking constantly what was placed, whether the numbers are matching. So this is something to pay attention to. Some of these grafts are, what I want you to see, for example, is this is a little bit deep. This is an empty site. You have to train your eye to see things. You see epidermal cap, epidermal cap, epidermal cap, empty site, empty site, empty site, empty site, empty site, empty site, dermal cap. So when I glance at this, I'm thinking, I see these, maybe it's an angle, maybe it's a matter of me coming from the side. I need to look at it better. Maybe it's an angle, maybe it's a matter of that they didn't place any grafts, maybe they're sinking, they're too deep. Train your eye to look for things. When placing grafts, if one is shorter than the other, I have, for example, this is one is shorter. If I place it in, if I don't place it correctly, it's hard for you to see. This shorter one is sitting on the top. So by forcing it, it kind of flipped up. It didn't make it to inside of the site. So what I do is I put two longer in, and then I feed the third one in so it all fit inside of the site. I'm going to, this would be showing that, and I realize here it's a little hard to show the hair curl and the hair angle. I'm just going to skip to the next one. These are these FUE or FUT grafts? It's a trick question. FUE grafts, what is different is you see them, they're more round. Okay, so these are not obviously round, right? See how these are round? Because they're cut with the same instrument. Can you see that? It's a subtle, I'm pressing the wrong button. So these are all round. And then the other thing is, if you look at this one is sticking up, so it's not placed in a correct direction, so the surface of the graft should be parallel with the surface of the scalp. Can you see that? Yeah, okay. And I had it a little bit magnified so you can see they're all pointing in the right direction. So when you look at the hair, it seems, because the hairs are short, the curl is not accentuated. So it may seem in FUE grafts, you're not necessarily looking at the curl as much as you're looking at this angle and how this cap is sitting on the skin. African American hair are curly. Sometimes they can change. This one is S shape, this one is J shape, this one is C shape. This is a same patient beard hair. All this is a beard. So you see how much difference can vary in a hair shaft. So it could be something you have to be aware in your assistant when they are transplanting, that there's a different shapes, different sizes, different thickness, and how to use that. Paying attention to hair color. So hair coming from the donor area that is in the temples is usually lighter, the back may be darker. You don't pay attention to that, you restore the temporal points, and then what happens is this patient has now this dark hair temporal points, darker, nothing doesn't match. He has temporal points, but they're not looking natural. So the color matters. Don't be cavalier if you're doing white hair. Sometimes yield bigger grafts, and then you can say, oh, I can be I can use bigger grafts with the white hair because it's harder to trim them, and just skip one hairs, or maybe just do a few one hairs. What if that person decides to color their hair? So once you commit what you place, you don't know what they decide to do in the future. So always think about the future. So what went wrong? Patient comes in, year later, and this is the result. So it's a poor growth, but what happened to cause this poor growth? It could be grafts that dried, it could be transection, right? It could be also too many sites, kinky hair, manipulation. So the crushing during the placement or scraping during the dissection. What went wrong here? I showed this picture earlier. It's a compression, right? It's also like a palm tree. Grafts being too big in inappropriate place and being in a small site. What went wrong here is pitting. You can see even in the follicular units, people think, oh, follicular units, I do a fine graft, small graft that can't ever cause pitting. It can still look pluggy and natural if they're not placed correctly, beside if the angle is not right. But if they're just simply not placed correctly, the skin grows around the hair shaft and it looks like, it's hard to see, it looks like a little kind of hole from which the hair is coming out. So it's not seamless. The way you see that, once again, is these hairs are shorter than these hairs. You see how this is a proper height, and these are sinking in. Hair curl, it's important to, at least if hair curl is pronounced, and if you see it, that all curl is facing downwards toward the scalp. Poor healing, this is really poor healing. So the difference between the first patient and this patient is that the first patient I showed you, and I'm going to go back to this one so I can just show you, this one never had the scab after everything looked fine after the hair transplant. So the healing went fine. We saw him at 10 days after. So it has to be something within, it could be blood supply, but it also could be how it was handled, right? And it's also, there's some fine growth in the area in the mid-skull. This one is definitely too many sites close together, and that caused it. So, unnatural result. What happened with this patient who shows up in our office, his problem was that in his first surgery, a physician said, I'm going to do convergence, so you're going to have a better density, but he can't style his hair. And then the other thing that he has a problem is, this is thick, but this is thin, right? So not only the direction, you can't just do whichever way you want it and kind of be really creative about it. There's a certain direction to respect the natural occurrence. With this patient, what went wrong is his incisions were placed, they were too high. Because if some of these hairs look up and some were lower and some were higher, it could have been assistant placing the graft with a hair curl going up or hair curl going down, right? If there's an inconsistency in a hairline, but this entire hairline looks like sticking up, that's probably the inclination, that how the angle of the site that directed that hair higher versus lower. It's again poor site creation. This person also has, besides incisions being made too high, this is even higher than the previous patient. What happened, it was a poor management too, and these were big grafts placed in the hairline. Too straight a hairline and so on. Surprise? Yes. Any questions?